What is the cervix in pregnancy? The cervix is a cylindrical structure in the lower part of the uterus that opens at the top end to the vagina. In pregnancy, it remains firm throughout but opens, shortens and softens during childbirth to allow safe passage of your baby through the same vaginal opening. If you happen to experience an unusually early cervix opening or one shortened beyond its normal, it could pose certain problems during pregnancy such as early-onset labor, so be sure to consult your doctor immediately. What is a short cervix in pregnancy? A short cervix is a sign that your cervix is shorter than normal, but don't worry, it's not necessarily a cause for concern. Prenatal care means the medical care that women who are pregnant get. Checking for a short cervix isn't done routinely during prenatal visits. Your doctor probably won't check your cervical length unless she is concerned about whether or not the cervix may be short. You have risk factors for premature birth, like if you had a premature birth in the past. Signs of preterm labor that begins too soon, before 37 weeks. What is the normal length of the cervix in pregnancy? Cervix length changes depending on the duration of pregnancy. Number 1. An average cervical length at 20 weeks gestation is about 40 millimeters, but individual women differ in the length of their cervix, and there is also a great deal of variation from week to week and from woman to woman. Number 2. If the length is less than 25 millimeters, it indicates that the baby's growth rate may be lower and therefore there is a higher risk of preterm birth. Number 3. If the length is a deal less than 15 millimeters, it is considered by doctors and midwives to be an abnormal situation that should be discussed further with your doctor or midwife. What is a posterior cervix in pregnancy? A cervix that tilts toward your back or bum is known as being in a posterior position, while a cervix that tilts toward your front is known as being located in an anterior location. What does it mean to have a posterior cervix? The majority of women have an external uterus and thus have a posteriorly positioned cervix, according to Robert O. Atlas, MD, FACOG. He is chairman of the Department of Obstetrics and Gynecology at Mercy Medical Center. It's less usual to have a self-cervix, which usually has an anteriorly positioned uterus, he says. However, if you're pregnant, your cervix's position may change as your due date nears. Typically, you will find that the cervix remains in a posterior position up until weeks 37 or 38. It won't be until then that the cervix will begin to prepare itself for childbirth and move forward into an anterior position. What is ectropion cervix in pregnancy? Cervical ectropion happens when cells from inside the cervix grow on the outside. These are redder, more sensitive than typical cells found on the outside and may cause symptoms like bleeding and discharge for some women. The condition is sometimes referred to as cervical erosion, entropy, or aversion. It's fairly common among women who are in their childbearing years, 15–45 years of age, and it usually isn't a cause for concern unless accompanied by other symptoms. When symptoms do not go away on their own, there are various treatments your doctor can try. What is an incompetent cervix in pregnancy? If a pregnancy is not developing properly, it may be due to the cervix weakening. Known as an incompetent cervix or cervical insufficiency, this happens when there is weak tissue in the birth canal causing premature labor or preventing a complete birth of a healthy child. If you experience an incompetent cervix, it may cause your cervix to open too soon and allow early birth. What is a friable cervix in pregnancy? Your cervical canal is the conical-shaped lower part of your uterus. It acts as a bridge between your uterus and vagina, so it's where the two structures meet. The word friable can be used to describe blocks of soil or tissue that tear, slough, or bleed more easily when touched. When you have an overactive immune response within your cervical canal walls and they become overly sensitive, it's known as a friable cervix and may be a sign that an infection is trying to take hold there. What is dilated cervix in pregnancy? The cervix, the lowest part of the uterus, opens when a woman has a baby, so as to allow labor to commence. When that happens, the cervix is said to be dilated. This process can help healthcare staff to track how well labor is progressing.